Assalamualaikum warahmatullahi wabarakatuh. Vehicle that may indirectly transmit an infectious agents include food, water, biological products, blood, and fomites, inanimate objects such as handkerchiefs, bedding, or surgical scalpels. A vehicle may passively carry a pathogens, a food, as food or water may carry hepatitis A virus. Alternatively, the vehicle may provide an environment in which the agent grows, multiplies, or produces toxin, as improperly canned food provide an environment that supports productions of botulinum toxin by Clostridium botulinum. Vectors such as mosquitoes, feed, fleas, and ticks may carry an infectious agents through poorly mechanical means or may support growth or changes in the agent. Examples of mechanical transmissions are flies carrying Shigellas on their appendages and fleas carrying Yersinia pestis, the causative agent of plague, in their gut. In contrast, in biological transmission, causative agent of malaria or gunny worm disease undergoes maturation in an intermediate host before it can be transmitted to human. Portal of entry. The portal of entry refers to the manner in which a pathogen enters a susceptible host. The portal of entry must provide access to tissues in which the pathogen can multiply or a toxin can act. Often, infectious agents use the same portal to enter a new host that they use to exit the source host. For example, influenza virus exits the respiratory tract of the source host and enters the respiratory tract of the new host. In contrast, many pathogens that cause gastroenteritis follow a so-called fecal-oral route because they exit the source host in feces or carried out on inadequately unwashed hands to a vehicle such as food, water, or utensils and enter a new host through the mouth. Other portal of entry include the skin, hook-worm, mucous membrane syphilis, and blood hepatitis B, human immunodeficiency virus. यानी कॉर्रा का जो एजेंट है वो फीसिस के थ्रू मुंह में जाता है और जो रेस्पिरेटरी होता है वो आमतौर पर रेस्पिरेटरी से निकलता है और दूसरे शख्स के रेस्पिरेटरी ट्रैक में एंटर हो जाता है. The final link in the chain of infection is a susceptible host. The susceptibility of a host depends on genetic or constitutional factors, specific community and non-specific factors that affect an individual's ability to resist infections or to limit pathogenicity. An individual's genetic makeup may either increase or decrease susceptibility. For example, persons with sickle cell traits seem to be at least partially protected from a particular type of malaria. Specific immunity refers to a protective antibodies that are directed against a specific agent. Such antibodies may develop in response to infections, vaccines, or toxins, or may be acquired by transplacental transfer from mother to fetus or by injections of antitoxins or immune globulins. Non-specific factors that defend against infection include the skin, mucous membrane, gastric acidity, cilia in the respiratory tract, the cough reflex, and non-specific immune response. Factors that may increase susceptibility to infection by disrupting host defenses include malnutrition, alcoholism, and disease or therapy that impairs the non-specific immune response. Implications for public health. The knowledge of the portal of exit and entry and mode of transmission provides a basis for determining appropriate control measures. In general, control measures are usually directed against the segment in the infection stage that is most susceptible to intervention unless practical issues indicate otherwise. Otherwise, for some diseases, most appropriate intervention may be directed at controlling or eliminating the agent as at its source. A patient is sick with a communicable disease may be treated with antibiotic to eliminate the infections, and Asymptomatic but infected persons may be treated both to clear the infection and to reduce the risk of transmission to others in the community. Soil may be decontaminated or covered to prevent escape of the agent. Some interventions are directed at the mode of transmissions. Interruptions of direct transmissions may be accomplished by isolations of someone with infections or counseling persons to avoid the specific type of contact associated with transmissions. Vehicle-borne transmissions may be interrupted by eliminations or decontaminations of the vehicle to prevent fecal-oral transmissions. Efforts often focus on rearranging the environment to reduce the risk of contaminations in the future and on changing behaviors such as promoting hand washings for airborne diseases. Strategies may be directed at modifying ventilations or air pressures and filtering or treating the air to interrupt vector-borne transmissions. Measures may be directed towards controlling the vector populations such as spraying to reduce the mosquito populations. Some strategies that protect portal of entry are simple and effective. For example, bed nets are used to protect sleeping persons from being bitten by a mosquito that may transmit malaria. A dentist mask and gloves are intended to protect the dentist from patient's blood secretions and droplets as well as to protect the persons from the dentist. Some interventions aims to increase a host defense. Vaccinations promote development of specific antibodies that protect against infections. On the other hand, prophylactic use of anti-malaria drugs recommended for visitor to malaria and endemic areas does not prevent exposure to mosquito bites but does prevent infections from taking root. Measures. Common frequency measures are ratio, proportions, and rates. Ratio is the relative magnitude of two quantities or comparison of any two values. It is calculated by dividing one variable by the other. The numerator and denominator is not too related, therefore one could compare apples with oranges or orange apples with number of physicians visits, number of person in one group and number of rate person in another group. In certain ratios, numerator and denominators are different categories of the same variable, such as males and females. In other ratio, numerator and denominators are completely different variables, such as the number of hospitals in a city and the size of the population living in that city. Ratios are common descriptions used in all fields. Inepidemic ratios are used to as both descriptive measures such as analytical tools as it is measures. Ratios can describe the male to female ratio of participants in a study or the ratio of control to cases to controls per case. As an analytical tool, ratio can be calculated for occurrence of illness, injury, or death between two groups. The numerator and denominator of a ratio can be related or unrelated. In other words, we are free to use a ratio to compare the number of males in a population with the number of females or to compare the number of resident in the population with the number of hospitals or dollars spent on over-the-counter medicines. Usually, the value of both the numerator and denominator of a ratio are divided by the value of one or the other. Thank you very much. Allah Hafiz.